Hello, welcome back to the channel. Today I have this intriguing subject but pretty educational called about pseudocyesis, or mostly known as psychological pregnancy. Yesterday I was finishing a series called The Tale of Lady Yeonwoo, and one of the characters called Yeonwoo. She faces this type of pseudocyesis during the series. She was having like this stressful type of moments, and there were like a lot of problems between the new family she was being part of and her own family by blood. And somehow her brain just started like to say like, okay, wait a minute, we need to stay here, we need to survive. And then she develops this type of psychological pregnancy. But what is it? According to the Journal of Nurse Practitioners, we're going to call pseudocyesis as a rare but debilitating somatic disorder in which a woman presents with outward signs of pregnancy, although she's not truly, of course, pregnant. Commonly, women of lower socioeconomic statuses, limited access to healthcare, and feeling under significant stress to conceive are most at risk for this disorder. Although depression is a frequent comorbidity alongside pseudocyesis, so this is like a complex type of somatic disorders that requires an understanding of similar like differences and treatments in regards of different options that we have in order to overcome it. The medical literature has reported about 550 cases of pseudocyesis, with patients ranging in age from 6 to 79 years old. The majority of cases occurring within the 20 to 44-year age group. So that's like a lot of people, isn't it? The World Health Organization's Mental Health Action Plan emphasizes the importance of improving women's mental health, particularly when coupled with significant stress, poverty, and domestic. I cannot discuss all of the words, which I dislike, but you already know what I'm talking about. Okay, so we're going to take like a study or a documentation from healthy people that in 2020, the estimates were telling that 1 in 17 American adults suffer from mental illness. Depression, which often underlies pseudocyesis, accounts for 4.3% of all diseases worldwide and is a leading cause of disability both globally and in the United States. Major depression involves a 40% to 60% increased risk for premature, I'm subscribing from living, say it that way, often as a result of additional poorly managed illnesses. Pseudocyesis commonly presents outside of the mental health setting, with like some somatic manifestation of pregnancy triggered by severe distress related to childbearing. For instance, recent, when you lose your little baby, infant loss, or extreme fear of pregnancy. Low socioeconomic statuses, limited education, a history of infertility, relationship instability, and having a partner that it's having some kind of abusive behaviors are a common feature of the female with pseudocyesis. And this is like pretty particular because we were talking about this young character in The Tale of Lady Yeonwoo, and she was facing something like pretty similar. She used this psychological pregnancy unconsciously as a way of surviving and to, of course, preserve her position within a family. She needed to stay away from her biological family, and when she got married, then there was like this kind of problem having on this new family, but she needed to remain there. Her pets were haunting her, but at some point she needed to stay in this new safe place that she was trying to build up, or at least just remain there for more time. Considering these attributes, might say. Pseudocyesis is more common in underdeveloped regions of the world, but is certainly not isolated to those areas. For instance, in Africa, its current incidence is relatively common, occurring in 1 of every 160 of infertility treatment patients, although historically the rate has been recorded as 1 in every 25 births. In developed countries, the incidence has decreased significantly over recent decades, luckily. However, the African American subculture maintains a greater predilection for pseudocyesis because of emphasis placed on fertility and motherhood. Now let's talk about pseudocyesis case report. I'm going to take a document from the University Department of Psychiatry of Croatia. We have like different names that I cannot pronounce, but here it says that pseudocyesis is actually a disorder that is rarely encountered in psychiatric practice. It is characterized by numerous signs and symptoms of pregnancy, except for confirmation of the presence of the fetus. The aim of this article is to present a patient with pseudocyesis. A 20-year-old woman, married, childless, was admitted to gynecology emergency clinic after a delivery that had allegedly occurred earlier that day. The examination showed neither pregnancy nor postpartum state. Therefore, consultant psychiatrist was included in patient examination. Upon review with the patient and her family, and in agreement with the gynecologist, the diagnosis of pseudocyesis was made. Pseudocyesis, or false pregnancy, is a disorder in which the woman has all signs of pregnancy except for the, of course, existence of a fetus. In the past, it was a common disorder. However, its rate has been greatly reduced with the development of prenatal care. In the past, pseudocyesis used to be classified into psychosomatic disorders, whereas nowadays it is classified into somatoform disorders, as we also did. The patient exhibited some kind of depressive symptoms, and this is like something that is frequently associated with this disorder. This feature was highly pronounced in our patient, or the patient of this paper, that actually she admitted herself that it was very difficult for her to be alone at home all day long. She stayed in marriage, fearing how she would stand being alone with her husband absent throughout the day, along with their, let's say, not satisfactory intimate life, to say it that way. She criticized her husband for not talking to her, excusing himself by being tired. It all came down to his providing to her or for her financially, while she felt he was not really interested in their marriage. She also felt her husband was not satisfied with her as his wife. So in order to have like a most summarize of the symptoms that a person with pseudocyesis could present, could be changes in appetite, nausea, weight gain, a sensation of fetal movement, breast enlargement or secretion, and even labor pain. The symptoms might persist from a few weeks to beyond 9 months. And what about this last factor? As far as the psychophysical complexities that this might be implying, anxiety and depression can lower pain threshold and increase pain intensity. And this may also explain the pregnancy pain or labor pain. Obesity, often observable in abdominal distension, is tightly linked with depression. Recurring cases of pseudocyesis have been recorded, giving credence to an underlying psychiatric disorder. When a mood disorder is the root of pseudocyesis, negative pregnancy markers are likely to antagonize the woman's psychological, just like lack of balance, to say it in general terms. Unfortunately, somatic diseases such as pseudocyesis often manifest in apathy to seek treatment for mental health concerns. Instead, these patients may present frequently for inconsequential physical ailments and therefore, of course, psychological consequences as well. But they need to discuss the cause or the root of these emotional or physical needs. Some suggestions for pharmacotherapy are limited in all the documentation that we have so far and all the papers that we have in order to face this somatic behavior. Dopamine has successfully treated pseudocyesis in animals, canines in particular, by suppressing prolactin levels, but the extent of prolactin's role in human pseudocyesis is not as well understood. In conclusion, pseudocyesis or false pregnancy is not rarely encountered in psychiatric practice, and when it occurs, a psychiatrist is usually included by lying or just by not having the right principle of the treatment of these patients. There isn't it is in some books, but the right treatment, as we mentioned before, if we want to include some meds, if we want to include some kind of whole program to treat it, it needs to go root by root, trying to know it is the cause of lack of something. It is something happening in the household. It is something happening at work. It is something that happened in the past. For example, the patient having some kind of previous depression, anxiety, or other type of mental illnesses in the past. But teamwork with various specialists, also including close work with the patient's family, plays a major role in the management of this pathology. The question of pseudocyesis as a somatoform disorder remains open for further elucidation, or just clarification perhaps. I think people are just wanting a manual. Me as a person who studies psychology also will be trying to know the complete and the most complete treatment for it. But to be honest, this is something I've been wanting to dig into it, because sometimes we tend to manage stress differently from each other. So when women are faced with this, of course, some people can be just pointing at them and say you were faking this, or you were a liar, or you just wanted to be the center of attention. And it's no, we need to dig deeper. We cannot judge at plain sight. We cannot see things just as a superficial way. Everything has a root. Everything has some kind of cause in between, because our body just responds to our emergencies, to our needs, to our thoughts, to our desires, and so on. And how it is going to respond most of the times is a mystery. We tend to develop things unconsciously, and sometimes this happens. A conclusion of it, a great example will be pseudocyesis. Some people just develop a false pregnancy without even knowing. And that is something that we need to talk more about, not only about this somatic disorder, about any other that people might judge and point out fingers really quickly without digging into it and say hey, I know, for example, if you cannot conceive, or you cannot be portraying this kind of life of the other person that is facing pseudocyesis or any other somatic disorder, it's just let's try to be there. Let's try to put our shoes on this other person's life for one time. Instead of judging, instead of pointing out fingers, instead of trying to be the most logical person as possible, try to be just thinking how the other person might be feeling. And with that being said, Have you ever heard of pseudocyesis? Did you know it was also called like that? I know people say false pregnancy, psychological pregnancy, but now the terminology will be pseudocyesis. Do you know that? And also, do you know somebody that have experienced that by yourself? If you want to comment that will be great. If not, I totally respect that. So thank you so much for being here. Subscribe for more educational content and interesting content in general. I do from history to psychology mostly, and also having this kind of myths. See that I just mentioned also the series I was watching. So thank you so much, and I really like doing these videos because you can watch it either you're watching this screen or not. So for people suffering from some kind of lack of attention disorders, like people that cannot take into one thing for a considerable or decent amount of time. Also for the people that have to work, that have to just drive, that have to be with kids, or their hands in something else, you can listen to these videos, my set of videos freely. You don't have to be watching my screens all the time because I'm going to pop up a bunch of images and videos. No. Slides, no. So you can watch it whatever you are doing and without being like focusing on the screen all the time. So thank you so much for being there. Send you kisses as always. Bye bye.